Welcome everyone to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of October 14th, 2024. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID and H5N1, I will talk about a couple of new important studies on COVID and children. So first, taking a look at COVID in the wastewater nationally, this is showing through October 5th, and we can see that levels on average are currently finally low. And the west in the darker teal is the highest. The Northeast in the pale blue is the lowest. And actually, that's pretty much been the case since we hit our most recent kind of low point in May. So for the past several months now, for some reason, the West has been the highest and higher than the national average, where the Northeast has been the lowest and lower than the national average. So I truly have no idea why that is. When we take a look at the map, we can see that New York, with 116 sites reporting, is showing minimal wastewater concentration of SARS-CoV-2. Illinois, with 75 sites reporting, is also minimal. California, with 56 sites, is now low. Finally, that's great after we were high for the entire summer, much higher than I think we expected. The state of Oregon, with 29 sites reporting, is still very high, and actually kind of that whole northwest corner of the United States is all still high to very high. And now there are at least 6 states represented by those diagonal lines that have so few sites reporting that it only represents less than 5% of the population in that state. So it may not be helpful or representative. But it is good to see this map finally starting to lighten up in much of the United States. And it's also good to see emergency department visits continue to come down nicely. They peaked in mid-August and have been coming down ever since. And this is showing us through October 7th. So remember, wastewater and emergency department visits are our earlier indicators. They're also the most timely reported. So when we see them coming down nicely like this, generally means that hospitalizations and deaths will follow. At the moment, we don't have a great line of sight on hospitalization since it's not required reporting anymore, although some states are still reporting. But we can see that deaths finally look like they might be leveling off here. We may have finally reached our summer peak of deaths at the end of August. So that week ending August 31st, we had 1,306 deaths. There have actually been over 1,000 deaths per week since the week ending August 10th. So hopefully we will start to see this coming down. We are starting to get into the time frame for flu season in the Northern Hemisphere, but it really hasn't started picking up just yet. Taking a look at variant proportions, we can mostly focus on that line at the bottom labeled 10/1/2024. This is showing us projections based upon the information that we have. KP.3.1.1 remains close to 60% of projected specimens, which is pretty much what I reported a couple of weeks ago. But what's new on this grid, and what wasn't here at all 2 weeks ago, is the XEC variant in the bright green, which is now almost at 11% and continuing to climb. And I was talking about this variant I've been talking about it for a few weeks now. It is recombined from 2 other variants, which are descendants of JN.1, which is what our updated vaccines are targeted towards. So our vaccines are expected to provide decent protection. So now turning to H5N1 or bird flu, the CDC says it's continuing to respond to the so-called public health challenge being posed by an outbreak that has been going on since pretty much the spring across multiple states in the United States. There have been 20 human cases of H5 since this past April, and half of them were associated with being exposed to infected poultry. 9 were from sick cows, so 10 from sick poultry, 9 from sick cows. 1 is still not determined because the patient had apparently not had contact with any sick animals. So currently, California seems to be having a number of outbreaks on dairy farms, which are mostly in the Central Valley. Looks like we've got at least 6, maybe 7, maybe more H5N1 cases in California. 2 of them are from the same farm, but they still don't believe it was human to human transmission. It seems that both of these individuals were exposed to sick animals. And so far, the illness in humans has been mostly like a respiratory tract infection, as well as an eye infection or conjunctivitis. And they have been doing some sequencing on the virus. And so far, there does not seem to be anything specifically worrisome. So it hasn't mutated away from our antiviral treatments or from the vaccinations that we may have, which is a good thing. Of course, the concern is that there's been so much transmission between cows. It has already been found in 14 states. There have been at least 300 outbreaks nationwide. Finally, it got to California. Turns out California is the nation's largest dairy producer, and these outbreaks seem to be happening kind of rapidly in California. So in just about 6 weeks, there have been at least 100 outbreaks among dairy herds in the state of California. So with so much spread, one of the big concerns is mutations. We know it already has mutated. We know that it is already adapted to be able to transmit between mammals efficiently, which it did not used to do. So the concern is, will it keep marching forward and be able to transmit from human to human? So this is something that's being monitored. Hopefully this will not happen, or if it does happen, we'll be adequately prepared. There is a vaccine that has been developed. There are others that are in development. They're not currently available to the general public. The CDC is monitoring what's going on around the variants, like I mentioned, so hopefully we can be ready if and when the time comes. But right now, the best thing we can do is just not get exposed, which for most people should be fairly straightforward. So don't consume raw milk and milk products. Don't touch wild birds or any dead animals. Cook your meats thoroughly. I think this last one here, if you work closely with animals, it really is becoming, it appears that it's becoming sort of a workplace hazard, that those that are overseeing these particular workplaces are going to need to ensure that the workers have adequate protection and are getting adequate guidance. So if you or a loved one happen to be in one of these industries, like dairy farms, then it's important that they know their rights and that they are advocating for those rights and that they are getting the proper protection, as well as outbreak response and access to testing and so on. Now turning to a couple of recent studies that I thought were important to review. You may have recently seen this headline: long COVID rates in kids revised upward. And of course, that's not something we ever want to hear, that we're revising upward, especially when it relates to our children. What it's referring to is the study published in JAMA, the Journal of the American Medical Association, this past August. And this study is pretty large. It followed 5,367 children, and it found that 20% of children in the 6 to 11-year-old age group and 14% of teenagers met the threshold for long COVID. So this is pretty similar to what we've been seeing in adults. And also similar to what we've seen in adults, what they found was that long COVID also affected nearly every organ system in kids and teenagers. So this is a multi-center study. So it's from a number of different locations, a longitudinal observational cohort study. So looking over time and just observing what's going on with this cohort or with this group of young people. And these participants were recruited from more than 60 healthcare and community health settings between March 2022 and December 2023. And this was looking at school-age children and adolescents with and without SARS-CoV-2 infection history. So it was comparing those who got SARS-CoV-2 with those who did not. So digging into the results a little bit, out of the 5,367 participants, and this was called the Recover Pediatrics Cohort Study. So out of the over 5,000 participants, 898 were in that school age, 6 to 11, and 4,469 adolescents were included. And there was decent race and demographic representation here, which we often don't see, and particularly in the area of long COVID, this has especially been an issue. But here among the kids, 11% were Black, 34% Latino, and with the adolescents, 13% Black and 21% Latino. And in both groups, it was almost 50-50 male and female. So this is also good. And they kind of looked at symptom clusters in these two age groups, similar to studies that we've seen on the adult side of things, as we've really tried to make sure that we have an adequate working understanding of long COVID. And what they found is 14 different symptoms in both the school-age children and the adolescents. And then there was a few that were more common, so 4 that were more common in school-age children. Those were the neurocognitive issues, so concentration and thinking, pain, and the GI symptoms, so issues with their stomach and their digestive system. And that was more in the 6 to 11 age group. And then in the adolescent or the teenage group, they were seeing more change in smell or taste, as well as pain and fatigue or malaise. And they were able to kind of group these things together to help give kind of a framework on how we're going to be looking at long COVID in children in the future. So like I mentioned, there was some overlap in the symptoms between these age groups of young people and similarities to the symptoms that we've seen in adults, but there are some differences depending on the age group. And this study helped to tease some of that out. I wanted to read a couple of quotes from the Medscape article that I just showed about this study, because I think that they're important to kind of put it in the context of what doctors and researchers are seeing. And the first is from a Dr. Lael Yonker, an associate professor of pediatrics at Harvard Medical School, who said, "Not only are kids not able to play the sports they once did, a lot of them have had to take weeks, months, or even whole years off from school. Other kids have had to switch to homeschooling. There's also been an impact on their social engagements because things like play dates present too much exertion and can set them way back." So this is serious and significant, particularly coming from a pediatrician, and noting that although there's been this big push to get the kids in school, let them go to school even if they're sick, this might be something we want to rethink, because if we've got somewhere in the area of 20% potentially getting long COVID, that's going to set them back much further than just a few days of having an acute infection and then risking spreading it to a bunch of other students and multiplying this problem that already seems enormous. Another quote is from the study author, Danilo Bonsenso, a researcher based in Italy, focused on long COVID in kids. And they said, "We're past the point of doing observational research. Now it's time to study effective treatments." So yes to that. A lot of folks in the field are saying that we've described the problem. It exists. It's enormous and growing by the day, and it's time to figure out how to treat it. In the meantime, parents, teachers, doctors need to be aware. Our kids need for us not to be in denial and need for us to be paying attention. We should be on the lookout for things like GI complaints in kids, changes in their energy level, how mentally sharp they seem. This could include poor performance in school. So let's not be chalking everything up to learning loss. We've had such a huge number of infections, and now we see that we have long COVID coming behind that. So let's pay attention and make sure that we get our young people the attention that they need. Also, be alert for complaints of extreme fatigue or brain fog, not being able to think as clearly as before. And let's not just assume that they're tired, they don't want to go to school. We should be paying attention when our children are seeming more fatigued than usual. And this, of course, all just underscores a key reason why we should be doing everything we can to prevent infection and reinfection in everyone, including and maybe especially in our children. This means improving ventilation in their schools, discouraging, in my opinion, sick children from attending school. And unfortunately, none of this really seems to be actively being done. And yet we can see that the risk of not doing so is very, very real. So now turning to another concerning study. This is just published on October 14th. And this was also published in JAMA, SARS-CoV-2 infection and new onset type 2 diabetes among pediatric patients 2020 to 2022. And this was a really important study, not only because it's huge, but because it looked at a comparison between young people getting COVID compared to young people who got other respiratory tract infections. So this is a little different than a lot of the other studies that we've seen, including the one that I just reviewed, which many of them look at COVID versus no COVID, but this one looks at COVID versus other respiratory tract infections. And I think this is important for a couple of reasons. One, I think that it is crucial that we learn as much as we can about post-infectious chronic diseases, whatever the infection, the original infection may be. This is a very important field of study. I think we maybe have underappreciated for too long. And I like to think that one positive thing that is coming out of this pandemic is that it's forced us to take a closer look at this phenomenon of getting an acute infection and then the things that may happen as a result of it. The second thing is that it does establish that unfortunately the risk of post-infectious new onset diabetes among children is significantly higher after COVID than other respiratory tract infections. And this is consistent with other things we've seen, like findings around the heart and lungs, where we're just seeing a much greater burden after COVID than other infections. So things do happen after other infections, but we're still seeing a disproportionate burden after COVID. We still have so much to learn, but obviously one of the big differences is that it's not just a respiratory tract infection. We know that it can affect just about any organ in the body, and that by itself is something very different than the other flu, RSV, and so forth. So this one is also a retrospective cohort study. So looking back at a group of patients, and this was a group of patients aged 10 to 19 years old. And like I said, this study was huge. It included 613,602 patients between January 1, 2020 and December 31, 2022. So full 3-year period here. And pediatric patients aged 10 to 19 without pre-existing diabetes. So only patients without pre-existing diabetes were eligible to be included in the study. And what they found was that there was an increased risk of new diagnoses of type 2 diabetes within 6 months following a diagnosis of COVID-19 compared with the diagnosis of other respiratory infections. So the patient age, the median patient age or the midpoint age was 14.9 years, 53% girls. So pretty close to half and half. And almost 18% Black, 16% Hispanic, 3% Asian. So pretty decent racial and ethnic distribution here. Half of the patients had COVID, the other half had another respiratory infection. And the bottom line they found here is that the children who had COVID were 1.5 times more likely to have a new onset of diabetes within 6 months of the acute infection compared to the other respiratory infections. So once again, this is pointing to an increasing burden of prolonged chronic conditions among children after COVID infection that looks very much on par with what we're seeing in adults. So although we know that children do better, generally speaking, with acute infection, particularly when it comes to the risk of hospitalization and death, unfortunately, it looks like they have a very similar risk of long COVID and post-COVID new-onset diabetes. So this is, of course, very unfortunate and very unwelcome news, because we know the risk that children are in are because of going to school and doing so much mixing every single day. And because they have so many years of life ahead of them that we hope will be healthy years of life, but now we're seeing an increasing burden of chronic infection following these acute infections. And it's much worse with COVID than with the other infections that are transmitted by the respiratory route. And unfortunately, with COVID, we're seeing people get it more than once a year. There's not seem to be a limit to how many times you can get COVID, and every infection is another opportunity for long COVID or a post-COVID impact. So this is a quite concerning situation that we find ourselves in. And so once again, doctors must be on alert, parents, teachers, everyone, we should be on alert for this unfortunate wave after the wave of COVID, which keeps continuing. We're having additional waves of long COVID, because that is how, unfortunately, that is how this is working. So this is one of the main reasons why we want to prevent infection and reinfection. And so we should be keeping up our best practices to do just that. The new vaccine is available. You should be able to get Pfizer, Moderna, and hopefully Novavax as well. And we should be masking indoors, gathering outside as much as possible. When you are indoors, paying attention to the ventilation and filtration. And then we should also be testing and isolating if we are not feeling well, and certainly if we're testing positive. And we should test to get out of isolation before we go around others, so that we don't spread what we've got, because we know that COVID is highly, highly contagious, and one person can spread it to many, many people. So if you have not yet ordered your free at-home test, please go ahead and take a moment and just do it now. It takes a minute. You just have to put in your name and address. And we know that this can be a challenge sometimes with people in shared housing and things like that. But if you're able to, please go to covidtest.gov and order your 4 free tests. And if you don't have a primary care provider, please get one. If you're someone who should be treated, if you get COVID, you should know that now. Let's please avoid you being among the thousands of people being hospitalized, the 1,000 people every week dying from COVID. These are still huge and pretty overwhelming numbers that pretty much eclipse all the other respiratory transmitted infections put together. And if you are someone who needs to be treated, it's your primary care doctor, provider, who's going to be having to be writing that prescription. So let's get this all sorted out now. Don't wait till you feel sick to try to get this figured out. That is not a good time to be trying to navigate all of this. And if you don't have a relationship with your primary care doctor, now is a great time to establish one. Get all of your baseline labs and your blood pressure checked, and know where you stand, know what screenings that you're supposed to get for your age and your risk factors. And remember to eat a balanced diet, incorporate fresh foods, avoid sugary drinks, limit alcohol, avoid processed foods, and eliminate tobacco. Get some regular physical activity, unless of course you don't feel well. In that case, please get your rest. And manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.